Jess and I are gonna get you a better butt. That was perfect. Yeah, no, it wasn't the original hook. The original hook was we're gonna talk butt stuff. But we're talking about your 3 glute muscles, how to know if they're problematic and how to fix them. I'm Dr. Sean Pastuch, the founder of Active Life, and I've seen, worked on a lot of butts. So today we're gonna make sure we fix yours. If you've got pain in your back, tightness in your hamstring, pain going down the side of your leg, pain going down the back of your leg, you're feeling weak, walking is difficult, you're limping, any of those things, even knee pain, fixing your glutes might make you feel a lot better. So we're gonna dive into the 3 glutes that you have, what the signs are that they're problematic, and what you need to do to strengthen and fix those problems. First things first, before we go any further, your glutes activate. If you can stand up out of a chair, your glutes activate. And I know what they say, speak to the language of the person who you're trying to communicate with. Well, you want the truth.
You can't handle the truth.
And you're not dumb enough to not be able to hear that your glutes activate. So if you can stand up, your glutes activate. Don't pay attention to anything about how to better activate your glutes. The next thing, I forgot. You have 3 glute muscles, the minimus, the medius, and the maximus. We're gonna break down them all. Let's start with the minimus. The glute minimus lives right up over here on the back of your pelvis. It's okay to touch that? Okay, well, I'm not. Yeah. Always use a pointer finger, not a full palm. The gluteus minimus, or the glute min, is going to internally rotate the leg, so rotate in, and then it's gonna bring your leg straight out to the side. There you go, you feel that one, don't you? Yeah, we found the problem for Jess. So one more time, from a different angle, internally rotates the leg and brings it straight out to the side. That's what the glute min does. If you're experiencing issues with your glute minimus, what you're probably feeling is discomfort behind the back of your hip, where we were touching earlier, limping, or difficulty or discomfort when you lay down on your side. So in Jess's case, we use the left leg. If she lays on her right side and she has glute minimus issue, she might feel discomfort behind the hip on the left side when she's in that position. Now we're gonna go over 2 exercises that you can do, a regression and a progression, to strengthen your glute minimus if it's an issue. We're gonna start off standing. Just like when Jess demonstrated what the gluteus minimus does to move the leg, that's also the strengthening exercise for it. If you're gonna be doing reps of this, it's always best to start off standing using something that gives you some balance, like an upright. What you're gonna do is, from this position, just internally rotate the leg a little bit and then bring it straight out to the side. When that gets really easy, we can start to progress it either by adding weight in the form of an ankle cuff or by coming down to the ground. So let's bring Jess down to the ground now. This is a progression from standing because now Jess has to move the entire weight of her leg. All she's gonna do is go ahead and turn it internally and start to lift it straight out to the side. Does that feel a little bit more intense?
Yes.
Outstanding, she said yes. Next up, let's talk about the gluteus medius. This is the glute med. It runs right over top of the glute minimus, and it's mostly responsible for hip abduction, internal rotation, and it stabilizes the pelvis when you're walking and you're standing on that leg. So we're looking at a very similar symptom set with one additional thing. There's a test we can do called Trendelenburg test. All Jess is gonna do is stand on one foot and squat down 1/3 of the way. That's it, that's all we're looking for. Stand back up. You didn't notice anything because she doesn't have what's called Trendelenburg sign. If she did, can you demonstrate what that would look like? We're just gonna pop the hip out this way and drive the knee towards the middle. So the knee would go that way, the hip would come out over here. It's a really uncomfortable thing, and it's what will show up when somebody walks. You can stop right there. They kind of get a little bit of what's called Waddle gait. You want to walk to the camera like you're waddling? That's a runway walk. Here's what we'll do. Let's overlay Jess with the penguin's body from the Batman show, and we can just put her head on it. Like that. Perfect. I have faith that Cleary did that. If you do have Trendelenburg sign, which Jess is simulating right now, you're gonna be putting pressure on the lateral meniscus, which is the buffer between your femur and your tibia, on the medial collateral ligament, which stabilizes the inside of the knee, and on the ACL, which you can't really see in here. It's a really good reason that people oftentimes, especially women in sports, end up with ACL injuries, meniscus injuries, and MCL injuries because of a large what's called Q angle. If the hips are really wide and the knee is already doing this when the glute med is weak, it's gonna overpressure the knee and cause damage. So a lot of knee issues are actually glute med issues. If your glute med is the problem, there are 4 exercises that you can do to improve it that are gonna work better than most other things. 2 of them are the same as the glute min that we already went over, so go back and review those. The 3rd exercise is a single leg squat to a target. So we can use a bench like this, and Jess is gonna stand on the one leg that would be the weaker leg and squat down to it. easy. If you don't have the strength to do what Jess just did, we can get a bumper plate from the gym, set it up on the bench, and now we have a higher target to squat to, and we can do the same thing. If the range of motion becomes so ridiculously short that you're not actually squatting anymore, you can grab something like a post and go ahead and do it all over again with external balance. The fourth exercise is sitting on a bench with your friend. No, I'm kidding, there's an exercise here. All we're gonna do is seated internal rotations of the femur. So you're gonna use the one you're gonna kick me with? Go ahead, she's gonna lift and just internally rotate just like that. Now again, this is something we can make harder by adding something like an ankle weight or a cable to the inside of the ankle. Next up is the glute max, which is right here, and I'm not gonna touch it.
I wanna touch it.
It has two main functions, hip extension and hip external rotation. It also has a role in hip adduction, but we're not gonna get into that because it's a complicated thing that happens with different fibers of the muscle than the standard fibers that we're usually talking about when we strengthen it. The most common symptoms you're gonna be feeling if you have a glute max issue are gonna be tight hamstrings because they're doing more than they're supposed to. Your glutes are supposed to be doing the job, but your hamstrings are. Low back pain because all the compression that you're putting into your low back from your glute not doing its job. Or the inability to stand from a seated position, which is probably not you, because if that's the case, you're beyond a YouTube video helping you out with your problem, and you already know that. You can have some knee pain with glute max issues, but most likely we're talking about the other two things we already discussed. The simplest exercise to do to strengthen your glutes is the squat. You can start with an air squat, or you can load with weight depending on where your fitness is already at. Go ahead and show them a squat, Jess. Hips drop below the crease of the knee, and then we stand all the way back up. If you need to squeeze your glutes at the top so you can feel what they're supposed to feel like, I like having people do that just so that they can start to get some proprioception of the muscle. So, one more time, all the way down, hips below the knees, and as you stand up, just squeeze your own butt with your butt, not with your hands. The second exercise is a simple glute bridge or a hip thrust, depending on what you decide you want to call it. I know, they're different, I get it. All we're gonna do here is put our hands at our sides, feet flat on the ground, and we're gonna lift our hips up off of the floor. That's it, plain and simple. Where you put your feet, you're gonna naturally put them in the closest to the right position. I haven't seen people try to do this and have their feet all the way out because it just doesn't make a ton of sense. But moving your feet from spot to spot is going to change slightly the fibers of the glute muscle that you're hitting when you do this exercise. If this is getting easy for you, or you don't want to load it up with a barbell on your waist and make it heavy, you can start by switching to single leg, especially if only one leg is your problem. So let's show them what a single leg glute bridge would look like. Go ahead. Exactly the same as two legs, but you're only gonna use one. Let's recap. The gluteus minimus lives right here behind the hip. It's deep to the gluteus medius. It internally rotates the leg and abducts it. So the same exercise you're doing right here is the exercise you're going to do to rehab it, whether it's standing, using some assisted support, or laying on your side. Up next is the gluteus medius, which is gonna be bigger and lives on top of the gluteus minimus. It's going to do the same thing, so internally rotate and abduct the thigh, and it also stabilizes the side of the pelvis that you're on when you're walking. If it's deficient, you're gonna see the knees start to dive in when you start to step and bend, and you're gonna see the hip slide out to that side. That's called Trendelenburg sign, and it's putting your knee at risk. Last is the glute max, right back there. The glute max extends the hip, so it brings the foot straight back. It externally rotates the leg. There you go, and every once in a while, it adducts it, but we're not even gonna talk about that today. If the glute max is problematic, we're gonna do exercises like hip thrusts and squats. I'm Dr. Sean Pastuch, and that's enough butt stuff for today. Remember that living with chronic pain is a choice. You can live more and hurt less if you like and subscribe and send this video to a friend.